more people in their 20s and 30s are being diagnosed with cancers that are typically seen in their 60s and 70s. In this episode, my guest, who is a leading cancer epidemiologist, is sounding the alarm about early-onset cancers, what her research reveals about environmental exposures like PFAS, and how the right to science connects researchers, communities, and the next generation of public health leaders. You're listening to the PHEC podcast, episode 442. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guest and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I'm the founder of Dr. C.H. Huntley, LLC, which is a public health and epidemiology consulting firm specializing in strategic planning for organizations working to build healthier communities. We help leaders make sense of overwhelming information, figure out what matters most, and what to do about it. We partner with organizations addressing the root causes of poor health, putting communities first, and translating technical information into plain language. We respect an organization's history and culture while helping them move forward, build on what's already happening and what's working rather than starting from scratch, and create plans that can actually be implemented. Please reach out to us through our website, drchhuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will also be provided in the show notes. I am excited to introduce you to my guest on this episode. My guest is an associate professor of cancer epidemiology who has published over 65 papers and mentored more than 100 students throughout her career. In this conversation, she discusses the alarming rise of early-onset cancers in young adults, her ongoing research on PFAS exposure near military bases, and why the right to science matters for both researchers and citizens. She also shares insights about student passions for environmental health issues, surprising data about public trust in scientists, and what it means to stay committed during challenging times. This episode connects individual research to urgent questions about health equity and environmental justice. Let me formally introduce her, and then I'll connect our conversation. Dr. Robin Taylor Wilson is an environmental cancer epidemiologist. She directs the Kidney Cancer Research Prevention Program at Temple University Barnett College of Public Health. Her research focuses on the intersection between genetic and environmental factors influencing kidney cancer risk. Dr. Wilson's research has been funded by the National Cancer Institute, the American Institute for Cancer Research, Pennsylvania State University, Pennsylvania Department of Health, Temple Fox Chase Cancer Center, United States Center for Disease Control and Prevention, Agency for Toxic Substances and Disease Registry, U.S. Food and Drug Administration, U.S. National Institutes of General Medical Sciences, and the U.S. Naval Health Research Center. Dr. Wilson is the founding principal investigator for 3 epidemiologic studies that have included over 2,000 participants. She has been awarded tenure at 2 Research One academic institutions, where she also taught courses in environmental health, cancer epidemiology, and molecular epidemiology. She is the former chair of the American Public Health Association's epidemiology section and is the current chair of the International Network for Epidemiology and Policy. She has 65 peer-reviewed publications, given over 200 research presentations, taught over 1,000 students, and served as mentor for over 100 students and faculty. Let's connect my conversation with Dr. Wilson right now. Public health is about connection, and now you have a space built just for that. The PHEC Podcast Community app is where public health professionals come together to collaborate, share ideas, and support one another. Inside, you'll find exclusive events like Power Hour, which is our virtual co-working event. It helps you connect with others and boost your productivity. You'll also have direct access to conversations with other public health professionals from around the world and even guests from previous podcast episodes. We're more than a podcast. We're a thriving community. Be a part of it. Download the PHEC Podcast Community app today and join us. Hi, Robin. How are you?
Hi. Nice to see you, Charlotte. Thank you for inviting me.
Oh, I'm really excited to have you here. And I thought when I saw you just a couple of months ago, I realized I never actually had you on the podcast. And that hits me sometimes because I'll have people in my head that I'm thinking, mental note, I'm going to invite them. And then if it doesn't happen, I'm thinking, sometimes my memory can play tricks on me, make me think I already did it when I didn't. But we're
Well,
here.
I'm delighted to be here, and thank you for all you do to communicate about public health, about epidemiology. I think getting the word out there even more important now than ever.
Oh yeah, I appreciate that. And yes, this is inspiring me to continue. This has been quite the year with all the challenges we've had for, with this administration kind of flipping the industry on its head and kind of trying to gut us out. And it's been quite the year. So this leaning into this work feels like something that I can do to, be part of a solution. So I'm excited that you're here. And let's start because we've been chatting a little bit before I hit record, but let's officially jump this off by having you introduce yourself for people who may not be familiar with who you are. Tell us a little about what you do.
Yeah, sure. I'm Associate Professor of Epidemiology and Biostatistics at the Barnett College of Public Health at Temple University in Philadelphia. Over my career, I've published over 65 papers. I've given over 200 presentations. I've taught. I recently did a count of over 1,000 students in courses. That was pretty exciting. And then I've had all the way from either high school, undergraduate, graduate, and faculty that I've been directly responsible for mentoring. So obviously I'm passionate about the research I do, but to me it's not any fun unless we can talk about it with students and really. So I just love being able to be in a college of public health. I just absolutely love it. Yeah.
Oh, wow. That's amazing. That is really amazing when you put the numbers together like that. And I can sense and feel and see how you light up when you talk about this. So the passion for it is pretty obvious. That is so I like to roll back a little bit when I talk to my guests on the podcast. I love to hear, and we're definitely going to dive into more of what you're doing and this research. But I always like to hear more about the journey, like how you got here. Sometimes the paths are just always different. So do you remember a time when you first learned about or became interested in public health as a career?
Yeah, absolutely. I was a master's student researching. I was getting a master's degree in geography and demography. And I was in the library and reading up for the background portion of my thesis. So I'd already almost completed everything except my thesis for my master's degree. And when I started to read, I realized there was this field called epidemiology. And I just remember standing there, and those are the old days when we're in the stacks, right? We actually had stacks. I'm standing there with the set of journals because that time they would, each year they would create a book of the journals, and just sitting there and realizing that is what I want to do. That's what I want to do. And then I started to look into programs in epidemiology, and it really, I mean, people couldn't pronounce the word epidemiology. I don't know if you remember this, but that was, they'd say epi what? And they'd say, are you studying skin? I think a lot of that has changed, especially thankfully, in the past 5 to 10 years. So I think a lot more people know about epidemiology, but for me, it was late in my kind of academic journey before I even knew what I was really wanted to do.
That's amazing. I hear that so often when I interview people about, like discovering, myself included. I first learned about public health when I decided to go to grad school because I was in healthcare and I was like, okay, well, I need to go to grad school I was working in microbiology in the lab. And it was like, "Well, what do I do next?" And someone said, "Well, you can get, like, an MBA and go into hospital administration and or you can get an MPH, and it's like a research type thing. You can go into public health." I'm like, "Well, what the heck is that? That sounds interesting." And, it's like we discover it and kinda start moving in that direction. So, I think that's interesting, and I also you reminded me when I started the podcast, so it's been 8 years now, and I wanna say it's episode number 2. I had asked a few people, "What is epidemiology?" People were talking about how it was so confusing. So 8 years ago, people were talking often about how they would get confused with, dermatology. People always thought it had something to do with skin, which makes sense because you hear epi and you think epidermis but when you said that, it reminded me it wasn't that long ago. Yeah, we were still and people still are confused, but not as much as, just in recent years. So happy that there's some improvement there, but we still have a ways to go.
Maybe one good thing out of COVID.
Right, right. That I would agree. That was something that at least they started to become familiar with the word and somewhat the industry, but still, I think it just more questions were surfacing. Just like cracking the surface there. So, you mentioned research. Is there a particular population or issue, disease, concern area that you are most passionate about, I should say, now?
Yeah, I mean, historically, my research has focused, there's been health disparities components of my research. And more recently, in addition to concerns over racial ethnic health disparities, I'm really concerned now about this increasing trend of increased incidence of cancer in young people and young adults. So we're seeing people in their 20s and 30s being diagnosed with cancers that typically we're not seeing until people were in their 60s and 70s. Colon cancer, ovarian cancer, kidney cancer, which is what I focus on. And I think what is particularly worrisome is that people aren't, as a young person, you're really not thinking, oh, these symptoms could be due to cancer. And I've heard that story multiple times. I had a lump or something just wasn't right. And I'm busy. I put it off. I'm either still in school or whatever. And I think just for the short term, increasing awareness about young age or early onset cancer, really important. And then the longer term, really focusing on prevention. Yeah, reducing exposures we think might be responsible.
So I definitely want to ask a bit more about that because we were talking a little bit before. I worked a little bit had 2 cancer indications I was responsible for when I worked I guess my last job before I was self-employed. But you've done some extensive work in cancer epidemiology specifically, right?
Yeah, I'm a cancer epidemiologist. Yeah, absolutely. Yeah.
Let's talk a little bit about that first, just because I know that I feel like people will be a little bit intrigued by that. We're going to be a little extra niche here because epidemiology being its own niche, but then also people don't really think about as an epidemiologist, you actually have multiple different areas that you can, specialize in, pretty similar to like medicine. So could you just speak to that a little bit?
Yeah, so part of the specialization in cancer epidemiology is going to involve a deep dive into pathology and the different classifications of cancer. I think we're kind of on a continuum in our thinking about cancer, right? So I think at one time we were thinking, well, cancer is over 100 different diseases, and we have these sort of deep dive specializations in a cancer type. So my specialty is kidney cancer. But what we're seeing is that in clinical trials, that one drug that treats one kind of cancer is also effective against another kind of cancer. And so it's becoming more that we're thinking in a larger systems perspective in terms of pathways that may lead to multiple different kinds of cancers, whether it's DNA repair or other kinds of biological pathways.
So you have been primarily because I know you've been in academia. And so this has been your research focus for many years, and I'm assuming you teach, biostatistics. Do you ever teach, like, specifically cancer epidemiology?
Yeah. Yeah, so I teach cancer epidemiology, environmental epidemiology, and then we have a PhD research methods. course. Yeah. So the students who are interested, they can take specialty courses in cancer epidemiology. So one of the reasons I think you were asking me to elaborate a little bit on career pathways, that we have an excellent system of cancer surveillance in the United States. And it was started with the National Cancer Institute. And we have a group of registrars that are trained in how we classify cancer. And that is one reason why these early, way back into the 1960s and 70s, these early investments in trying to understand cancer have really paid off. And so thinking now about our investments, right? Now is not the time, with rising incidence in cancer, now is not the time to stop those investments.
I definitely understand. And am sort of really aware of the implications only because when I worked as, an epidemiologist and I had those two cancer indications, I was responsible for estimating patient populations, right? At a global level. So I had 7 countries specifically that I was responsible for estimating. So that meant that I went to those country specific registries, and some were definitely more robust than others. And so we were looking at this historical data, and even as with what I would consider robust registries, there were still all these gaps and challenges with the data. So now that I'm thinking about where we are now with this attack on science and removal of funding, how that impacts how we're able to collect data and monitor, that has serious implications in the future as we're trying to still understand patterns and trends. How is this kind of connecting to, I mean, yes, I love that you are focused on and that there are people out there focused on what's happening with these younger people that are getting cancers that were traditionally maybe diagnosed a little bit later. But how are you seeing this as what's changing with our focus, not our, but maybe the nation's shift in prioritizing science and research and being able to address issues like this? Does that pose a special type of threat that people aren't really aware of or thinking about?
Yeah. Well, I think we don't have a current survey on public interests or how much they trust scientists, for example. But the International Network for Epidemiology and Policy, we are working on a statement about the right to science. And as part of that, one of the things we've been looking at are national surveys regarding public beliefs, thinking about science in general. It's not it is hard to even get sort of the pulse about public health. What does the general public think about public health? But during COVID, there was a national survey that was put out, and I can send you the link to it. And so it was a privately funded group, and they worked with a university in Ohio. And what I found really interesting about that is that they actually found during COVID, a high proportion of respondents, over 85%, said that they trusted scientists. They either trusted them or they highly trusted them. So I guess, Charlotte, going back to the kind of data that we collect as epidemiologists and thinking about whether these attacks on science actually are representative of either the general population at all, perhaps we might question that, right? That the general population may actually have a high degree of trust. And I think as I was reading that, I think it really makes you stop and take stock of what an important statement that is, right? That people are putting their trust in you. And so, what we try to do for our students is really emphasize this. Every detail has got to be investigated and looked at, and carefully your methods, your data, you have to know it backwards and forwards, because We are highly trusted. We are in a position of trust, and it's just, I mean, it's humbling and it is a little bit daunting, but I think it should all make us sit up and say, okay, we're going to put out the best absolute work that we can and try to understand these trends going on in the general population and identify factors so that we can promote health to the greatest degree possible. That's a long-winded kind of answer. And as you can tell, my thinking on the rights to science is not fully, we haven't finished our statement on that, but I think in researching it at minimum, I think it's been an important journey for me to see what the general public does think.
Well, that's really good to hear. I just know that what we see from our political views is very different. So it's just been very disheartening. It's been very, for a lot of folks that are really fighting for science and newfound advocates really advocating for science. And there are a whole lot of coalitions that I've engaged with folks that are working there and involved with advocating for science because of just what we've seen, from our government and from, what mainstream views in this year has been saying very differently. So it's great to hear what you found in research. Is just, it's kind of like we're meeting. It's just disheartening sometimes when we're trying to still do that. We want to embrace and know that the work that we do is high integrity and that it's very important. We know this, but then when we get pushback from, mainstream, it's just difficult. And I've heard that a lot this year.
Yeah. I mean, yeah, I'm not going to sugarcoat it at all. I mean, it is shocking. It's absolutely disheartening. And nobody likes to see false information bandied about. But at the same time, do not give up. Do not give up. And I think, if anything, it certainly has made us think a lot more about who we are and what's important. So I oftentimes like to think, for any bad thing that's happening, there can be a good side to it as well. So I'm hoping that we'll come out of this on the other end really knowing more about who we are, what we're capable of, and we know the costs. We know the costs of inaction. People are going to die, right? So we need to stay active. We need to keep up the work, and we need to do it in a way, like I said at the top of the podcast. I mean, your work is so important in communicating what we do in a real world way that people can understand. And if anything, certainly people on the research side, like myself and others, we always can do more, can do better to bridge to bridge that gap, to connect with communities, and realize this is not a one-way street of information, right? It's not just I'm telling someone in the community something. It is really just as important for me to come with a humble attitude and learn, what can I learn about what's going on in this community? What are people seeing that I might not see? And maybe triangulate that and discuss it and try to work towards prevention. And there may be things that ideas that you'll have just by connecting with the community that you would never have had you not done that.
Yeah, yeah. And this policy statement for INEP is in progress now?
Yes. Yeah. On the right to science. Right. Yeah. So there's two portions to that. So it started after World War II. And so the two parts are, first, that, I mean, basically, as I think most scientists realize that done this work, I have a right to benefit from it. I have a right to freely investigate things. But I don't think we also, as scientists, think about the second part of that, which is that there is a citizen's right to science, the citizen's right to participate, to benefit from scientific innovation. And so the extent that to which the general population is not benefiting from scientific innovation, then that's a breach of the right to science, right? So public health is a key player in promoting the right to science so that we have innovations, whether it's in public health programs or vaccine development or cancer screening, that delivery to ensuring that people are receiving those benefits of those scientific advances. That's that a major part of the right to science.
Yeah, that's great. So what are there any you mentioned, a couple things. Are there any other challenges that you are facing in your role right now or how you're addressing those if you have any?
Yeah, so certainly ev- everybody wants more research funding. Everybody wants more funding. I think certainly my concern is, yeah, funding for the research, but also funding for trainees and making sure we have that pipeline of students that can come behind us and do the work and innovate. In terms of best thing we can do is work with our professional societies and advocate. I think the American Public Health Association has done a great job in terms of advocating on our behalf. And I think, I guess I would like to see us as a society focus more on the next generation, right? Focus on funding, bringing in new investigators, training, providing that kind of pipeline of expertise, if you will. Yeah.
Yeah. So that made me think of something. What are some of your students excited about? What is the buzz in terms of getting into careers focus? I know this is, again, very different type of a year and feel, but what are you hearing from your students? Or maybe even some recent graduates in terms of, what are they're getting into?
Part of the issue is hiring. So, I've had a number of calls and discussions with students that have, recently graduated. I mean, it's rough out there, but knowing others, not in academia, and I think it's difficult across the board, right? I think all sectors of the economy are not sure about next steps. And so a lot of sectors are cutting back. So it's just tough for everybody. I think, I'm guessing, I don't know. I think a lot of people are choosing to go back to graduate school. So I think there's a renewed enthusiasm there. So, but in terms of what students are excited about or what they're really passionate about, it's the environment, right? It's the environment. Whether it's climate change or the multiple chemical exposures that we just get exposed to walking around on an everyday basis. Yeah, students come to me directly and say, "What can we do? What can we do on this campus? What can we do at the university? What can we do as individuals?" That's heavy on the minds of students. Yeah.
Yeah, I've heard a lot of innovation from the students I've talked to recently, and I applaud that and really encourage that. I love to hear the ideas.
Yeah, no, yeah, look, yeah, I'm not gonna complain. I love being at university, and I love talking to students and hearing what they think. Yeah, no, I love that.
I think especially now they've caught my attention because of all the times to really be pursuing public health when it's so challenging. Those that are choosing to be in it now, I find that they really need a little extra encouragement. I really want to encourage and protect and support them because that's our next generation.
Yeah, yeah, I think you're right, but I do think, I mean, especially with the misinformation that's out there, I mean, students wanna know how to combat it. They wanna know, "How can I get to the bottom of this? How can I find things that are," and that's what we do in public health. We help people learn what are reputable sources and what are not reputable sources. So when I see the light bulb go on and they've learned a new life skill of how to find, accurate health information, yeah, that's a win. Mhm. I agree.
I have really enjoyed our conversation. I want to be mindful of time, but is there anything that you have coming up that you're, really excited about or really focused on here that we haven't already touched on?
So we have one of our studies that's wrapping up. I'm not a leader, I'm just a collaborator, but it's the National Multi-Site Study. And Pennsylvania is one of those sites, and I'm a co-investigator on that project. And it's wrapping up after over 5 years. And we're coming down the tracks of wrapping up those investigations, and we'll be reporting back to the community on health effects related to exposure to per and polyfluoroalkyl substances that have resulted in communities that are surrounding these former military bases where people have been exposed primarily through drinking water. So I'm yeah, I'm excited about it. I have really enjoyed working with our community partners as well as our partners here in PA as well as at the other sites. I've learned a tremendous amount, and I'm really hopeful that the work will promote more national work on reducing our chemical exposures overall. It's not just these communities near Air Force bases. It is a national issue that we've got to address.
Yeah. So much important work to be done, right?
Yeah, well, thank you again, Charlotte. It's such a delight to see you. And thank you so much for the opportunity to talk a little bit about my journey. And I just wish you all the best with these podcasts. Again, thank you so much for what you're doing.
Amazing. Thank you for your time. And this has been a great conversation. I appreciate you, Robin.
All right. Take care, Charlotte.
I really hope you enjoyed that conversation as much as we did. Robin's work on the right to science reveals an important truth. Innovation means nothing if communities can't access its benefits. Her research on cancer and environmental exposures shows why sustained investment in surveillance and prevention matters now more than ever. As students demand tools to combat misinformation and address environmental threats, they're stepping into a field that needs their energy and ideas. The path forward requires both rigorous science and humble community partnerships. Whether you are researching, teaching, or advocating, your commitment to accessible, trustworthy science helps protect this fundamental right for everyone. I encourage you to connect with Dr. Wilson and learn more about the great work that she's doing. You can find the links to connect with her on the show notes page. The show notes page for this episode, which is episode 442, can be found at phecpodcast.com. Once you're there, just navigate to episode 442 to find its show notes. One more thing before we go. Remember that our podcast has an app and private community where you can engage with public health professionals around the world. You can download the PHEC Podcast Community app in your mobile app store, and it is available for both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.